Right, hi, let's now think about doing trigger point work. What is it? We've already discussed that a little, but let me just recap. Trigger point being an area which is over switched on, the muscles are on too much, usually because of overuse, but it can be injury based as well. Today I want to really kind of bring in that continual story of round shoulderedness, and when we're round and contracted here, the muscles at the back here are working hard to stabilize. Trigger point therapy works incredibly well. So anatomy is important here. So spine of the scapula and coming up into levator scapula, which is that really knotty, hypersensitive area of that tendon where it attaches onto the edge of the scapula. All along this muscle and through the trapezius, you can feel these kind of gristly, knotty areas. Let's now call them trigger points. The technique of working with them is that you would warm them up and get them nice and kind of flexible before you kind of find one and then start to put pressure on. Now, number of ways you can do this. I'm going to pick one way today where supported fingers dropping into a gristly kind of trigger point area. Lots of communication with your client at this time on that 1 to 5 scale. Don't really want to go above a 3 or a 4. So it's going to be sensitive and sore, but not quite manageable from a client point of view. And then be patient. Allow the client to take a breath in. And as that person sort of breathes out and relaxes, you allow your pressure to sink into that tissue and hold that trigger point area. Might be here 10, 15 seconds, might be longer. I also like to incorporate movement. So while I'm pressing and holding this trigger point area, I might get Christy just to bring her head over to the side and stretch that muscle while I'm working on it. I might incorporate bringing the chin to the right armpit and then just stretching that muscle, and you can begin to feel the tissue loosen and melt underneath my fingers there. Now, once you've finished, you do a bit of a there, and you might do some, your normal techniques where you come through and use your forearm. And then you go back and do the same thing again, maybe in a slightly different area, but you're working your way up the muscle, feeling through the tight fibers, finding areas that are hypersensitive, dropping in, getting the client to breathe and release, and then incorporating some movement with it too. So really nice technique, really beneficial. Don't forget, trigger points have that referring pain structure to them. So you might be working here, but the client might well be getting eye pain, head pain, neck pain. Or it could be localized and coming down the back too. So it's a great therapy, really worth learning the skills and being patient with. Come and have a go.